Hi and welcome. My name is Jason Keogh from JK Therapy, Sports and Injury Clinic. The type of clients that visit me can be divided into two camps. Those that have sports-related pain and injuries, you guys should head over to my video on this side of the page to find out more information about that. And those that have general related pain and injuries, this is the video for you guys so you know what to expect when you come to visit me here in the clinic. Firstly, please note that you don't have to be an elite athlete to suffer pain and be deemed worthwhile to receive treatment. The majority of my clients fit into the general pain and injuries category, and some of the most gratifying work I do as a therapist is in helping people with chronic pain to dramatically improve their lives. So, you may have had an injury recently at home or work and are looking to tackle it head on and get back to normality. Or you might have hurt yourself quite a long time ago and it's just never felt quite right since then. Or finally, you mightn't actually remember hurting yourself, but pain and stiffness has somehow crept into your life over a gradual period of time. And amazingly, some people write this off as just being life's wear and tear and just being part and parcel of getting older, but I don't believe in this. I think there's ways to improve your pain. So if you find yourself in any of these categories, you've come to the right place. Let's talk a bit about your pain. When you injure yourself from a fall, a slip, or a sudden and unexpected movement, the muscles involved can get a jolt, straining themselves and becoming very tight. Now, these tight muscles will restrict your movement by pulling on a joint in your body. So, for example, your knees, your hips, your ankles, your wrists, or your shoulder. And the muscles surrounding these joints then can become quite sore or tender when you press on them. So firstly, a golden rule to remember. Healthy muscles shouldn't be sore to press on or to rub. If they are, they're having a bit of a crisis which needs to be fixed. You might even feel like you have pain in your joint or around it, but 95% of the time it's caused by the tight surrounding muscles. You develop what we call trigger points, but you may actually feel them as knots in your muscles when we start working on them. They can mimic everything from toothaches to headaches to making conditions such as arthritis even more painful than arthritis has to be. My job as a neuromuscular therapist is to use a variety of precise pressure, massage on the muscles, as well as many other kinds of techniques to encourage these knots to release, which will then eliminate the pain you feel when you use these muscles. Neuromuscular therapy has proven to be one of the most effective treatments for musculoskeletal injuries because we specialize in the health and functionality of muscles, and we take a holistic view of the body and its movement systems. We do a full medical screening assessment beforehand, taking into account your lifestyle, the current injury that you're presenting with, and any other previous historical injuries which may help us get to the bottom of your pain. We can use a postural assessment using software, and this will help us tell us what the current state of your body is in. We can use a series of mobility tests which tells us what the range of motion is like in your muscles and joints. Rather than just focus on what part of your body is sore, we try to determine where the actual source of this pain is using a range of different tests. We then use this information to come up with an effective treatment plan on how we're going to tackle this injury and provide you with lasting pain relief. Well, at the end of your very first session, you can expect to see noticeable improvements in pain levels and stiffness. Depending on the type and severity of the injury, we generally expect to see lasting results and a return to normality after just a few sessions. More serious injuries, such as fractures, ruptures, tears, etc., can take quite a while to recover from, under the guidance of your doctor or consultant, of course, but together we can construct a plan to get you back moving in record time. No, it doesn't have to be. I use a simple and very effective communication system when working with people where you rate the pressure and the pain as I work. So the last thing I want a client on my plinth to be doing is wincing in pain, as this will cause you to tense up those muscles that we want to actually work out. This means that whether you have a low or a high pain threshold, the pressure used is relative to you. I've had great feedback with this method from all my clients. So please feel free to call or email me before you book in to see if I can help you with your particular pain or injury. Bye for now.